If you are facing a hip replacement surgery, no doubt you have lots of questions. You've probably been talking to an awful lot of your friends who perhaps have gone through a similar procedure, and you're probably feeling pretty good because it seems like advances have happened now to make hip replacement surgery a lot easier for people. But we're going to get some answers this morning from the expert himself. Dr. Joshua Lawson joins us this morning with the Center for Sports Medicine. Good to see you this morning.
Good morning. Thanks for having me.
I said what I said intentionally because it's really remarkable to me to think back even 5 or 6 years ago when people would have to have hip replacement surgery. You kind of would wince and say, oh my goodness, I'm so sorry. Now it seems like it's just almost a cakewalk for most people.
It is getting a lot easier. I think our techniques, some of our pain control options have gotten a lot better. And yes, it's turned from a week stay in a hospital to, for many patients, going home the same day, and the majority at the most staying one night in the hospital and getting back home.
That's
very few people need to go to rehab or anything like that anymore.
That's very remarkable. So I know one thing that you focus on with your practice is something called anterior hip replacement surgery. I'm going to let you explain what that is, but is it something that almost all of your patients can take advantage of, or do you have to meet certain criteria?
Sure. So there are some selection criteria that we try to follow, but the majority of patients are candidates. The people who typically are not are patients who need a little bit more of a complex hip replacement, whether that's a revision or they have previous hardware or some anatomic abnormalities that need to be addressed. Those type patients we typically do more of a traditional approach for, but your standard patient, BMI typically less than 35, are good candidates for this approach. And what's different about an anterior approach compared to a traditional is incisions more along the front of the thigh, the front and the side, and we work between the muscle layers rather than working through a muscle or having to release muscle from bone. And that gives us access to the hip in a less traumatic fashion, meaning patients typically have less pain, they retain more of their strength after surgery, and can meet their functional demands a fair bit quicker.
When we were talking earlier about the advances made on the surgical side, advances also have been made on the hardware side, since you mentioned hardware a minute ago. If you get a hip replacement these days, about how long should you expect it to last?
So I typically advise at least 20 to 25 years.
Wow.
I think it's actually fairly uncommon that we're seeing the newer design implants either loosen from the bone or the plastic liners wear out. It takes a lot of wear and tear. Typically, if a hip is needing to be exchanged, it's because of an infection, some sort of traumatic injury, or if they're having problems with instability or the hips dislocating, which is typically less than 2% from all approaches. And with an anterior approach, it's even less, traditionally less than 1%.
So when a patient comes into your practice, I mean, I'm sure that they've been going through quite a long time of having issues and difficulties with their hip, but is it always pain that's associated, or is it sometimes that instability concern like you just referenced?
So I definitely like to look for pain as the reason for having surgery. Most people aren't having instability with primary arthritis. Obviously, if they've already had a hip replacement, yes, instability is definitely a concern that we sometimes see and need to revise hips. But it's traditionally pain, particularly along the front of the hip or along the side. That's hallmark for hip arthritis.
So when you mentioned earlier with the anterior hip replacements, especially the quick recovery time, that really is remarkable, perhaps not even a full day in the hospital. Is it pretty much a guarantee if you have that you will not need physical therapy, or is that again a case-by-case basis?
It's a bit of a case-by-case basis. I still typically refer most patients to physical therapy because they have been limited for so long. Most patients, this is not something that just came on very quickly. It's something they've been struggling with for months or years sometimes. And so there are some deficits that can be addressed to optimize their function after the surgery. Sometimes they developed abnormal gait patterns or a limp that sometimes takes some training to resolve. So I do think most patients benefit from some therapy, but it's an individual basis on how long that lasts.
All right. Well, it is a pleasure talking to you this morning, and aren't you lucky to be able to bring us a procedure that's so well received and easy for us to get back into life with after we've done it. So thank you so much for your time.
Thanks for having me. Y'all have a good day.
You do the same. You can get in touch with Dr. Lawson and the full team of orthopedic specialists there at the Center for Sports Medicine. As you well know, they have locations all around town, but the Macaulay Avenue location, pretty much the central office, and so that phone number to call is 624-2696. You can also go online to sportmed.com. We're back after this.